The number one question I get when I say metabolic health is, what is that? So today I'm going to break down what it is, how we measure it, why it matters, way more than your BMI. Hi, I'm Dr. Meghan Tierney, founder of Sorrel Health and Wellness in Seattle, Washington. I am a family and obesity medicine board certified physician and menopause specialist. I help women navigate menopause, perimenopause, obesity, and metabolic health with a weight neutral approach, focusing on health and function and not the scale or before and after photos. Today, we're talking about metabolic health. Let's dive in. So, what is it? It is your body's ability to efficiently process the energy that you consume, and use that energy to keep all the systems of your body stable. So you can kind of think about it like a car engine. So you put fuel into the car uses that fuel to make the engine run, the wheels turn, the brakes work. You can tell I know a lot about cars, but that's generally the sense of what it is. So when we think about it in your body, it's like, do you have stable blood sugar? Is your blood pressure under control? Are you appropriately using the fat that you're consuming and not storing it in places that your body shouldn't? And generally, do you have good energy distribution? So the energy that you consume is distributed to all the right places, and that all of those places can use it appropriately and efficiently. All right, so we kind of know what metabolic health is. Like, how do we measure it, or how do we screen for poor metabolic health? And I think the big question is can you use BMI to determine if someone is metabolically healthy? And the answer is no. Um, which I think doesn't necessarily surprise people as much as it used to. But BMI historically has been used to assess people's risk factors for diabetes and high blood pressure, cardiovascular disease like heart attacks and strokes. Sort of all of those things, increased risk of cancer. And so we have historically used BMI because honestly, it's easy to use. It's easy to do. It's easy to measure people's height and weight. And it turns out that it doesn't really correlate that well with those risks. We know that approximately 20% of people who have what is considered a normal BMI have components of poor metabolic health. And there are people with an elevated BMI who can be metabolically healthy. So it's not a great measure. So how do we actually measure or screen for poor metabolic health? So the first one is we're going to look at blood sugar. So how does your body use energy like glucose when you consume it? How does it use it? And is it efficient? So we're going to check your fasting glucose. We might check your A1C, which is a way to calculate what your blood sugar has been, average blood sugar has been over the last 3 months. We might also check a fasting insulin, which when put in a ratio with your fasting glucose, be a way to evaluate for very early insulin resistance before your blood sugar is elevated or before your A1C is elevated. Another thing, obviously, is to check your blood pressure. So an abnormal blood pressure is a sign that maybe something is off with the way that your body is using the energy that you consume. The other one is checking your cholesterol and triglycerides. So that's, again, a way to see how your body is processing the fats that you consume and the fats that are within your body. And if your cholesterol or triglycerides are elevated, that's associated with an increased risk of insulin resistance. And insulin resistance is just another way of saying your body isn't using glucose very efficiently. We also know that elevated cholesterol or triglycerides are associated with an increased risk of heart attack and stroke. And then another one is waist to hip ratio. This is historically not something that I do in the office. I think it's very triggering to bring out a measuring tape. I personally can think of times when I was a kid and being measured for like costumes for a play or for clothes that my mom was making, and seeing that my measurements were not quote unquote normal. So, and how that felt as a kid. And I just think that women don't, we just don't like being measured. And so I don't really use that. But the reason we can use that to potentially correlate with increased risk is because we know that fat around the belly is associated with these risks. It's associated with increased insulin resistance. It is associated with increased cardiovascular risk. And that's all because the fat around our belly is metabolically active. It is putting out hormones, it's putting out proteins, it's putting out inflammatory cytokines, all these things that our body does not really want. And it is really putting a wrench in the system. And so when we are measuring a waist to hip ratio, what we're doing is really trying to sort of screen for elevated adipose tissue around the belly, because that's the stuff that causes the risk. And then finally, sometimes we don't really measure this, but sometimes people who have excess adipose tissue around their belly might see that they have increased CRP, which is an inflammatory marker that's very nonspecific, or they might have elevated white blood cells. Again, another sign of that inflammation that is being produced by those fat cells which are very metabolically active. So it's a lot of big words and a lot of big things to think about. So why does it matter? Why do we care what these things are? Why do we care so much about figuring out ways to screen for this issue? And it's really because metabolic health is predictive of your long-term wellness, right? It's more predictive than your weight alone or your BMI. It's about how your body functions, not about how it looks. And what happens, say, like if all those things go wrong, like that's called metabolic syndrome, and that is even more associated. So, like when you have high blood pressure, when you have elevated blood sugar, when you have abnormal cholesterol, all of that together is something called metabolic syndrome. And that is very, very much associated with increased risks of type 2 diabetes, of heart disease, of stroke, of certain cancers, and even dementia. So those are all the bad things. What does good metabolic health look like? What does good metabolic health bring you? So it's probably going to make you feel more energetic, less fatigue, probably a better mood. You're going to get better sleep. You are going to have reduced risk of disease. So all of those things we talked about, all the diseases I've said over and over again, type 2 diabetes, heart attacks, strokes, certain cancers, all of those are reduced. And here's the thing, is that you can have reduction, can have improvement on all of those things and not lose a lot of weight. So if you're doing all of the things to improve your metabolic health and I don't know, you lose a few pounds, you are still going to see those benefits. So you don't have to be what is considered a normal BMI to see those benefits. And that's why I think it's really important that we sort of separate the two between what is your weight and what are your functional improvements. So what can we actually do to improve our metabolic health? There are things that are in our control and there are things that are outside of our control. So things that are in our control are what and when we eat, how we move our body, how we sleep, how much sleep we're getting, stress management. We can't control the stress in our lives. We can't control those events, but we can control how we cope with them. And obviously not smoking and reducing or cutting out alcohol. Things that are not in our control. So how old we are. Getting older is going to increase all of our risks. Genetics, some medical conditions and medications that we take can increase our risk, and some environmental exposures. But really, the point is that there are things that are within our control, and so we can focus on those things. And we can't change the other things, and that's okay. That's okay. It doesn't matter. Let it go. So what's the key takeaway here? The key takeaway is that metabolic health is about function, not form. It's about how well your body is working, not how it looks, not how much it weighs. This is why I focus on these markers in my practice instead of weight, because what I'm looking for my patients is long-term health and wellness that fits within their lives, and not an after photo. And so we want to optimize our body functions. We want to address those root causes and support that long-term wellness. If you're ready to focus on your metabolic health during perimenopause and menopause, or you are a woman with metabolic health concerns, I would love to support you. If you live in Washington State, please feel free to follow the link below to book a discovery call to learn more about how we offer personalized evidence-based care to help you reach your lifelong health goals. And if you found this helpful, I would love for you to like, share, and subscribe. Thanks for watching. I'll see you next time.